Let's talk about the new way.
Okay.
How would you describe the way we do it, which we're calling the new way?
Mm-hmm. Well, first of all, in our model as a concierge practice, we have a little more flexibility and freedom to order some of the things
Right.
that we do for our members because we're not entirely bound by insurance constraints. So specifically specialized lab work that's on our intake labs that we look at for our members, and some diagnostic testing, which we'll talk about in a minute. So to your previous point, sometimes the old way is what it is because it's defined by those realities.
That's right.
And so you may be limited by only getting those tests in the old way, such as a baseline EKG, or a stress test if you're lucky, a basic lipid panel where they're just looking at total cholesterol, HDL.
And screening you for symptoms.
Yeah, and screening you for symptoms. But I think where we take it to the next level is we look at it from more of an offensive standpoint, which we talked about in the last podcast, which was one of my favorites, is being hunters of things that take people off the planet and looking at the root cause. And so one of the root causes of heart disease is actually metabolic disease. And so on the spectrum of heart disease, like you already alluded to, you don't wake up and have diabetes. Like this has been a slow burn for a while. And maybe you just weren't screened properly to know your risk factors. But
all the signs were there
Yeah.
if they would have been looked for and looked at.
One of the biggest risk factors for cardiovascular disease is actually insulin resistance.
That's right.
So if you think about it from a metabolic standpoint and reverse engineer that, some of the testing that we do and we look for is rooted in inflammation, in whether or not your body's processing insulin well, what is your triglyceride to HDL ratio, is your body processing carbohydrates and well at all? Where is that extra carbohydrate going? Is it, turning into fat? Do you have fatty liver? Like all of these things. If we can eliminate the root cause and help you with that, then we lower your risk for heart disease. I think the other really big thing is your family history. So delving into, did your parents have an early cardiovascular event? What does their cholesterol profile look like? If you know, do they have high blood pressure? And when did that start to happen? What is your stress like? What is your sleep like? Measuring these things is really important. We use wearable tech to do that.
That's right.
We go for an aggressive weight loss stance. We want to eliminate visceral fat at all costs. We have a special machine that is able to tell us what your visceral fat is. And a lot of people don't know what that is, but it's that deep underlying fat around your organs. It's very pro-inflammatory.
That's right.
Puts you at a huge risk for heart disease. And we just want to attack that at all costs. So really, it's more of an offensive take on it. And you can kind of talk a little bit more about the specific tests and things that we look for in our members. But what I'm excited about for them and for everybody listening to this is 9 times out of 10, they're very cheap things that you can ask for, like inexpensive, even if you have to work around the insurance model. And if you know these numbers, you can make significant strides toward lowering your risk.
I couldn't agree more. I mean, I think, look, it is the way that it is. And a large contributor to the current state of things and the fact that we continue to play defensive-minded medicine is that we have a sick care model.
Yeah.
We're not designed, it's not designed to make you healthy. It's designed to keep you sick but not die.
Right.
Like, I mean, that's just the reality of it. And unless your sickness is bad enough to do something new treatment, new procedure, new drug, then you're being managed. It's a disease management system. We have the good fortune of being outside of that system and being able to actually do health care.
Right.
As opposed to sick care, which is 100% of the insurance-based model. And look, it's better than nothing, but like, my hope is that this message would be encouraging to those who want, demand, can afford a better way, because there is a better way.
Yeah.
And for those who can't budget a service like ours, which, look, there's a lot of people who can't, and I'm super sympathetic to that. But I want to be able to equip you with what to ask for many times, if you ask for it in the right way, your provider can bill for it in a way that might get paid for. But even if it didn't, these are these spot tests that would be worth investing in your health. You cannot count on your insurance to have your best interest in mind. Their goals and your goals are not aligned.
Right.
They're
Yeah.
just not.
And, you know, if we were having this conversation 5 years from now and you had a cardiovascular event, I guarantee you would want to invest a couple $100 to get this
To know
test.
early,
Right.
to prevent
Yeah.
bad outcomes,
Yeah.
and to see if there's still time on the spectrum to change the course.